So today we're going to be dealing with a trauma patient. I have my proper PPE on. My scene is safe. The mechanism of injury would be a car accident. There's only one patient that needs assistance. I am going to call EMS support just because of the car accident and the head trauma. I'm going to need some help. And I would stabilize the spine due to the incident. My general impression is that the patient is stuck in the car and is still waiting, is sitting still in his seat with bleeding coming from the head. The patient seems unresponsive due to no response to any stimuli, whether it be verbal or actually physical touch. The life threat would be head trauma and no response to any stimuli. The airway is open due to the chest rise and fall, but I would insert an airway adjunct just because he is unconscious and I do want to keep that airway open 24/7. The breathing does seem to be slightly labored with slightly low ventilation, but the O2 does have normal levels. I would still apply a non-rebreather mask just to ensure that he gets the adequate amount of oxygen to make sure he's okay. The pulse is normal. The rate, rhythm, and quality I'll check out. The skin is fine as far as the temperature and how it feels. No abrasions. No, it's not cold or cool or moist. It's nice and dry. It just seems that he's been knocked out from the car accident, so I am going to decide to transport him just because he is unconscious, and he's unconscious, has head trauma, and has labored breathing, so I want to get him to the emergency room as soon as I can. Then I would take note of his blood pressure, his pulse, and his respiration rate. The sample probably wouldn't be able to be completed since he is unconscious, so I'd have to get it when he is conscious or from his family members. And this would be like symptoms, allergies, medications, prior medical history, his last oral intake, or the events leading up to this head trauma incident. From then, I would begin to inspect the head. So I would start off, I just feel in behind his head, start to see, feel behind his head for anything around the ears, check his eyes, and then check his mouth for any abnormalities, any fractures or anything that does not seem normal around this area. And then I will then follow by checking his neck, making sure the trachea is aligned. Then checking the jugular veins for no jugular distension. And I would also come behind him and check his cervical spine for any abnormalities. Following this, I would then go ahead and check his chest for any, I'd palpate the chest for any, feel anything weird. And then I would also oscillate and listen to all the quadrants to make sure both of his lungs are still intact and haven't collapsed yet. From then I would move to the abdomen and also palpate the abdomen to make sure everything feels okay in there. And then I would go ahead and check the pelvis for stabilization, make sure the pelvis hasn't been fractured. After this, we go down to the lower extremities, make sure the femur and the tibial and fibular are still intact, no fractures. I would check for capillary refill. Do the same thing for the other side. Check the capillary refill. And I would move up to the upper extremities. Do the same thing around the upper arm and lower arm. Check for any fractures. Same thing, capillary refill. Same thing on the other side. Capillary refill. Then I would ask for help from my partner or whoever's around the scene that could help me, and flip my patient over while stabilizing the spine, stabilizing the head, and go ahead for check for any abnormalities going down the back, and then making sure nothing's in the rectum in the rear, then laying back down gently. Then I would manage any secondary incidents, His only abrasions or cuts were on his head, but there wasn't any major bleeding. So we passed that step, and now we're gonna go back and just bandage his head up to make sure we take care of any of the small cuts that he could possibly have. And then I would then reassess him every 5 minutes during transportation, just because he is unconscious and has slightly low um, breathing rate and ventilation rate. So I just want to make sure he's good.